State medical experts release findings of the status of your health. The annual study outlines health issues impacting residents and officials and say our ranking is improving. 3 on your sides. Rosalind Anderson shares those grades and where we still need to improve.
During White Coat Day at the Capitol, an analysis of Mississippi health conditions was announced by the State Health Department and the Mississippi State Medical Association. The 2025 Public Health Report Card outlined health indicators, areas of progress, and issues requiring attention. Mississippi has risen to 48th in the nation in the overall health ranking. Opioid deaths, teen births, and accidental deaths are decreasing. The state is 3rd in the nation for vaccinations.
It's been a long time coming. For us, 4 years ago, we weren't just 50th, we were 50th way in the back of the pack. And so for us to have closed that gap meant more Mississippians living longer.
Meanwhile, there remain high rates of infant and maternal mortality, obesity, hypertension, and diabetes.
We have to get our infant mortality rate down. I'm excited with the work that we're doing at the Department of Health, but I'm more excited about the comprehensive work being done among all of our partners statewide.
The state health officer describes the health of the population as inadequate but better. Officials say 35,000 Mississippians die each year, a death rate that must be reduced. The state is described as worst in the nation for firearm deaths. At the Capitol, Rosalind Anderson, 3 on your side.